Hi everyone, Stuart Hinds back here again. We have the wonderful Monica Brennan with us, our 400 metre runner from Rio. Today we're going to talk a little bit about Achilles tendinopathies. Unfortunately for Monica, she's got a little bit of an episode at the moment. We're at wonderful Albert Park Lake, so I'm going to show you a few techniques to help with dealing with these sort of reactive tendinopathies. So one of the first things, as you'll see in some of the things that we've talked about before in treating calf injuries, is the gastro-soleus complex. That obviously gets overloaded, and when you have a change of programs and so forth, sometimes that invites some of this irritability and irritation. So from a soft tissue point of view, especially from a soft tissue therapist point of view, what can we do to help this? So one of the things straight away, and I say to all of the students that I lecture to, especially at Vic Uni, is that we need to be reducing as much tension and load as we can through that gastro-soleus. Best way to assess whether or not they're tight is just bend the knee 90 degrees here, come down into dorsiflexion and ask if there's any tightness. Okay, so if I've just recently done this with Mon and she's got a little bit of tightness in feeling that, so they shouldn't feel any tightness in that. So the first thing we need to do is address where and how they feel it. So we're going to look specifically at that soleus and then obviously the upper part of the gastro as well. Now there's not rocket science to this, because the beauty of just offloading this sort of tissue is about challenging it and taking up as much of the belly tightness, okay, which inevitably will reduce any excessive load onto that tendon. So come along and watch me go through this. So we're going to start with the lateral part of the soleus. So we're going to come down, I'm going to engage until I start to feel a little bit of feedback back from Monica. And I'm just going to glide along the length of it and just stopping short as the gastros come into place just through here. So just coming down through. See, if this has got to be purposeful, don't play around in terms of going light, but at the same time you don't want to go too deep and have them pushing it back against you. So the art of deloading is about engaging with the tissue, they can accept it and not push against you, which is exactly what we're getting there for Mon. So that's not too deep, is it, Mon? No, that's good. Right, now as we start to deload that, then we want to introduce a little bit of movement, if we can as well, into that foot. So the first thing we're going to do here is just bring the leg a little bit off the side of the table so I can introduce a little bit of dorsiflexion. So I'm just going to bring your leg out a little bit more there, Mon. Okay, so I'm going to use my thigh to basically be the mechanic for moving the foot as I go into dorsiflexion here and work through this tissue. So I'm going to come here. So as you can see, as I push forward with my thigh, we're going to get a bit of dorsiflexion at the same time. So we're going to challenge the tissue at the same time. Now don't force it. Worst thing you can do is try and force this tissue. It's just gauging, feeling the tissue, working through it and working with it as opposed to against it. Unfortunately, there's a lot of therapists out there that feel working as deep as they can is obviously going to be the most therapeutic, and that's not the case at all. Okay, so now we're going to come out to, I'm going to change legs, I'm going to swap around and I'm going to hit that medial side of that soleus now. So once again, I'm going to swap my hands around here. I'm going to come in through this way. Same sort of scenario again, just start to glide along, working with that tissue. You're a lot tighter on your medial, Monica. So slow, purposeful, engage the tissue, feel for it, work through the range of movement. These are all the things. Sounds simple, but there is a bit of an art to it. Okay, now just quickly, another way we can go in and engage this is just coming and sitting on the table here as well. I'm going to put the foot into plantar flexion now, and I'm going to hook in just to that lateral part again. Press in towards me and then slowly down into a longitudinal glide. Once again, stop short, just at the gastro lateral head. And try and avoid pushing too deep and having them push back against you. Great, simple.
So, if you even remotely enjoyed some of that content, please do me a favour and hit the like button below, just so that I know that you did enjoy it. Also, if you don't want to miss out on any of the content that we put up on a regular basis, then the best way to do that is obviously just to hit the subscribe button. So it's a bit of a no-brainer. But most importantly, if you really want to see the true show, the real show, take the opportunity, hit the link below, stuarthinds.com. That's where we have all the comprehensive assessment, treatment of a whole range of conditions. That's where we have our online courses and obviously our mentoring and so forth, the webinars and our podcasts. So if you're even remotely interested in what we do, go and check it out. Appreciate it. But also, most importantly, again, just be awesome at what you do.